This podcast is sponsored and brought to you by HealthShare Integrated Solutions.
Mr. Douglas's ordeal and the need for healthcare standards. Mr. Douglas in the ambulance inside the rattling vehicle as it sped through the humid evening. Mr. Douglas groaned, clutching his chest, beads of sweat streaming down his pale face. The paramedics reassured him that they were moments away from the hospital, yet what awaited them was a facility whose poor design would prove as much a hazard as his health crisis. When the ambulance screeched to a halt at the hospital's entrance, confusion greeted them. The emergency ward was tucked behind an unmarked corridor, forcing the paramedics to navigate a maze of ill-placed doors and narrow hallways. A vital 10 minutes was lost before Mr. Douglas was wheeled into the emergency room, which itself was cramped and cluttered, with cables dangling haphazardly from medical equipment. The walls bore signs of neglect, their paint peeling, while the ceiling fans whirred lazily, unable to disperse the stifling heat. The doctors and nurses, clearly overburdened, sprang into action despite the chaotic environment. But the inefficiencies of the hospital layout compounded the challenges. The pharmacy was located on the third floor, accessible only by a single unreliable elevator. A nurse had to sprint up the stairs to retrieve life-saving medication, her frustration evident as she returned breathless. In the hospital stairwell, as evening fell, a nurse had to sprint up the stairs to retrieve life-saving medication. Her frustration was evident as she returned breathless. Meanwhile, Mr. Douglas's condition deteriorated. The operating theatre was situated at the far end of the building, separated from the emergency room by a series of poorly lit passageways. As the medical team wheeled him through these corridors, they were delayed further by patients and visitors crowding the space due to a lack of designated waiting areas. An antiquated air conditioning system left the operating theatre uncomfortably warm, complicating the surgeon's efforts. Despite the staff's best efforts, Mr. Douglas's ordeal highlighted the dire state of the facility. The hospital's design flaws, from its labyrinthine layout to its inadequate infrastructure, not only delayed critical care, but also placed an undue burden on its already strained personnel. Mr. Douglas survived the night thanks to the skill and determination of the medical team, but his experience underscored a larger issue: the absence of comprehensive standards and a regulatory framework for healthcare facilities in Nigeria. Without clear guidelines on hospital design, safety protocols, and infrastructural requirements, countless patients would continue to face unnecessary risks. The urgency for reform could not be clearer. For Mr. Douglas and others like him, the promise of healthcare must be matched by environments that facilitate rather than hinder healing. Nigeria's healthcare system, already grappling with limited resources, cannot afford the additional burden of inefficiency born from poor design. Establishing and enforcing standards is not just a matter of aesthetics, it is a life-saving imperative. Here are key reasons highlighting this urgency. Improved quality of care. Standards ensure that healthcare facilities provide consistent, high-quality services. This helps to reduce medical errors, enhance patient safety, and improve health outcomes. Regulatory frameworks define minimum acceptable practices, ensuring healthcare providers meet the required standards. Patient safety and trust. A robust regulatory framework protects patients from unsafe practices, substandard facilities, and unqualified personnel. Trust in the healthcare system grows when patients know facilities are regularly inspected and comply with established standards. Efficient resource utilization. Standards enable more efficient allocation and utilization of limited healthcare resources, ensuring that facilities are adequately equipped and staffed. This reduces redundancy and promotes cost-effective healthcare delivery. Compliance with global best practices. Developing a regulatory framework aligned with international standards positions Nigeria to benefit from global partnerships and funding opportunities. It ensures the country is better prepared to address public health emergencies and pandemics. Reduction of medical tourism. Many Nigerians travel abroad for medical care due to a lack of confidence in local healthcare facilities. By improving standards, Nigeria can reduce medical tourism and retain revenue within the country. Encouragement of private sector investment. Clear and enforceable regulations provide a stable environment for private investors in healthcare, promoting the development of modern, well-equipped facilities. This can help bridge the gap between demand and supply in the healthcare sector. Strengthened public health response. Standardized healthcare facilities are critical for effective disease surveillance, prevention, and control. They provide reliable data for policymaking and epidemic management. Equity in healthcare delivery. A national framework ensures equitable access to quality healthcare services across rural and urban areas, reducing disparities in healthcare delivery, international accreditation and recognition. Adopting and enforcing standards can pave the way for Nigerian healthcare facilities to receive international accreditation, boosting their reputation and appeal. Accountability and transparency. Regulatory frameworks enhance accountability among healthcare providers and administrators, ensuring resources are used effectively and ethically. Conclusion. The development of standards and a regulatory framework for healthcare facilities in Nigeria is a critical step toward achieving universal health coverage, enhancing public health outcomes, and fostering sustainable economic growth. The time to act is now, as delays may lead to further erosion of trust in the healthcare system and exacerbate existing challenges.